Ready to get started, Serena, if you're ready.
Okay. Well, I'll start with introducing myself. I am Serena Thomas. I'm Program Director at Homeward Alliance. Thank you so much for joining us to learn more about the Murphy Center. To kick us off, I want to introduce David Root, our Executive Director. He started with Homeward Alliance as an intern, became our Executive Director in 2014, and from what I've heard, has done nearly every job in between. In addition to leading our organization, he represents Homeward Alliance on multiple task forces. He serves on CSU's School of Social Work Advisory Board and sits on the Board of Directors for Outreach Fort Collins. So do you want to start, David?
Yes. Hello, everybody. I hope everybody can hear me okay. I was having internet issues, so I went into our Mason Street office. I have a blank background for today. Normally I have something exciting. I like to have something in the background. As Serena said, my name is David Root. I'm the Executive Director of Homeward Alliance. Homeward Alliance is the operator of the Murphy Center. And so I'm going to give you just a brief overview of the history of the Murphy Center and then pass it off to Pam to show a video. But just so you know, the sort of the direction that we're headed with this presentation. I'm going to give a history. We'll do a visual tour and overview. SummitStone Health Partners is going to give us a brief presentation of their work at the Murphy Center. We're going to hear from our Health Initiative Director, and then we're going to open it up to question and answers. So just so everybody knows the structure of where we're headed. Excuse me. So the Murphy Center was opened in February 2009, after about a decade-long process, maybe a little bit less, of trying to get the Murphy Center started. It was a broad collaborative of individuals and agencies. And the Murphy Center itself was really the brainchild of a woman named Sister Mary Alice Murphy, hence the name, the Sister Mary Alice Murphy Center for Hope, who is mostly responsible for founding a lot of the agencies that you've heard of in Fort Collins that provide services to people experiencing homelessness. She was the original founder of Catholic Charities in Fort Collins. She founded our Hand Up Employment Program, Care Housing, of course, the Murphy Center. Sister Mary Alice has and I'm omitting a few because there's just too many to list, but she had this vision for many years of having a location where people experiencing homelessness and providers who serve people experiencing homelessness could come together under one roof and provide services in a coordinated, sort of collaborative way. For far too many years, she and other community leaders had watched as people experiencing homelessness languished for years in the community, spending most of their days traveling from resource to resource to resource, and often being excluded from resources because the referral process and the transportation issues were so onerous. And so after many years of fundraising and advocacy, the building opened in 2009 under the ownership of United Way of Larimer County and under the operations of what was then Larimer Center for Mental Health, what is today SummitStone Health Partners. The Murphy Center has evolved over the years, but its original mission remains the same today, its primary original mission, and that is that it is less a service provider than a container of services. That is to say, the Murphy Center, what makes the Murphy Center unique is not so much the services that are offered within it, but the fact that all of those services are offered under one roof by various participating agencies and in close collaboration with one another. Over the years, the Murphy Center has had many agencies providing services on site. There have been 3 operating agencies: SummitStone Health Partners, followed by Serve 6.8, and then Homeward Alliance took over at the end of 2015. December 2015, Homeward Alliance assumed operations of the Murphy Center in close partnership with what we call our Partner Council. And the Partner Council has evolved a bit and looks a little bit different today than what it does. But basically, the Partner Council was established as a group of 4 agencies: Homeward Alliance, Catholic Charities, SummitStone Health Partners, and Neighbor to Neighbor, 4 agencies that were primary service providers on site every day at the Murphy Center, And these 4 agencies collectively agreed to oversee the long-term vision and mission of the Murphy Center, with Homeward Alliance as the operator. So I think the easiest way to think of that is that that's sort of like a board of directors, but the board is comprised of people who either work in the Murphy Center or their agencies work in the Murphy Center. Today, actually, let me say pre-COVID, the Murphy Center was host to about 20 agencies that provided 40 unique services to anywhere between 2,000 and 3,000 people a year, sort of depending on the year. The Murphy Center itself and our staff have a couple of primary functions. One is to oversee the provision of core services at the Murphy Center. These are basic needs services, things like showers, laundry, lockers, mail, etc. And then our other primary function is to facilitate collaboration and ensure a continuity of services among the agencies that operate programming at the Murphy Center. So what that looks like is case conferencing meetings, it's building meetings, it's day-to-day sort of collaboration, it's warm handoffs, walking people down the hall to meet with a partner agency. Sort of all the things that you can imagine, big and small, that go into making sure that thousands of people who come in our door are accessing the correct the services that they need the most. Obviously, over the last year, there's been a dramatic shift in the way the Murphy Center provides services. For many, many, many years, for the entire history of the Murphy Center has been has relied on volunteers to perform a variety of functions. At the Murphy Center a year ago, what that looked like mostly was the actual administration of those core services, things like showers, lockers, laundry, mail. And when the pandemic began, we lost a huge percentage of our Murphy Center volunteers. Many were elderly or had underlying conditions and were unable to continue volunteering at the time. So in a nutshell, we had to both find new volunteers, which we did in some cases, but also fill some of the roles that formerly had been performed by volunteers with staff. So in the future, we certainly look forward to a sort of revival of the Murphy Center, where volunteers can once again return and really provide robust assistance in the area of core services, so that our staffs and the staffs of the other agencies providing services at the Murphy Center can focus on what their core missions are. So I'm going to pass it off to Pam to share a video, but and we'll take questions at the end. But that is a general history of the Murphy Center.
Welcome to the Murphy Center. We are located at 242 Conifer Street, Fort Collins, just 3 doors down from the Food Bank's Blue Roost locations, and about a 1-mile walk from both the Catholic Charities and Fort Collins Rescue Mission overnight shelters. Homeward Alliance both operates the Murphy Center and provides services within the building alongside about 20 other independent nonprofits. On-site partner agencies include SummitStone Health Partners, Volunteers of America Veteran Programs, Catholic Charities, the Street Dog Coalition, and many more. In 2020, the MC served 2,129 unduplicated individuals. As a hub of services for people experiencing homelessness and housing insecurity in Larimer County, the Murphy Center is effectively the front door for community members in need of help. This one-stop shop model simplifies access to services by providing one location from which people can access dozens of programs and services. Each person and family who seeks services at the Murphy Center has unique goals. For some, they only need basic services and quickly return to housing and economic stability. Others need comprehensive support and services, often related to age, disability, or substance use disorders. Because there are no two people with the same needs, the Murphy Center does not employ a one-size-fits-all approach to services. Instead, new guests are provided with a comprehensive intake session designed to help identify their goals and provide referrals to on-site and off-site partner agencies and programs. We like to call those warm handoffs. A primary goal of each intake is to conduct what is called a shelter diversion. This is a nationally recognized best practice process designed to help people identify alternatives to entering the homeless services system. For some guests, a bus ticket to a confirmed safe place, such as a living with family or a one-time rent assistance and landlord mediation, can prevent homelessness. For people who do not have an alternative to homelessness, our intake specialists first help guests meet their basic needs. Often this includes food, gear, outerwear, access to showers and laundry, and establishing a mailing address. Once basic needs are attended to, intake specialists help guests access needed services. If the guest is a military veteran, for example, they would be referred to our 2 veteran partner agencies on site. If the person is struggling with mental health or substance use disorder and desires help with those issues, they would be referred to our on-site therapist from SummitStone Health Partners. If a guest is seeking a job, they are referred to Homeward Alliance's Hand Up Employment Program, and so on. In all, the Murphy Center offers about 40 unique services. Weekly case consultation meetings ensure that on-site partners are operating in coordination. Homeward Alliance also employs staff called resource navigators who help Murphy Center guests navigate technology, medical, public benefits, and other complex systems. The navigators support the work of intake specialists and on-site partner agencies. For instance, in order to secure housing, people need to be what's called document ready. This means having a valid ID, birth certificate, and proof of income or disability. A navigator might be asked by a guest to help them obtain an official copy of their birth certificate, help filling out housing paperwork, help deciphering a letter from their doctor, or maybe support logging into a telehealth appointment. The goal of resource navigation is to help people overcome barriers, both large and small, in their journey to housing. The Murphy Center also provides day shelter Monday through Sunday, 8 a.m. to 5 p.m. This provides people with a safe place to be with access to basic needs such as a place to rest, restrooms, food and water, and crisis intervention services. The Murphy Center was founded and continues to flourish because it enjoys a wide range of community supports. This includes the cities of Fort Collins and Loveland, foundations, local community groups and businesses, our faith community, and many more. Since our inception, volunteers have also served a crucial role in the operations of the Murphy Center. In 2020, the Murphy Center played a central role in helping 306 people escape homelessness. To learn more about the Murphy Center, including ways you can help, please email us at info@homewardalliance.org.
But we will have that video on our YouTube, right? Is that right, Pam?
Yes.
We also will have a recording of this presentation also available, correct? All right.
We can send both out to all participants, the link to the YouTube video, so you can hear it a little more clearly. I actually could hear it okay on my end. I don't know how it was for everybody else. I think it kind of depended on your internet connection a little bit.
Maybe.
It was pretty, it got really clear for me after about 30 seconds. So sorry if that wasn't the case for folks.
Well, you did hear in that video about how we have many partners that collaborate with us at the Murphy Center. So I'd like to introduce one of those partners. We have Jessica Coe, a licensed clinical social worker with SummitStone Health Partners.
Hello. Hope everyone's having a nice day. So my name is Jessica Coe, and I am a program manager for SummitStone's homeless and housing programs. And I'm sorry if you hear my dog in the background being ridiculous right now. And I have been, I've been with SummitStone for about 15 and a half years, and I've been at the Murphy Center, or at least connected with teams that I have working at the Murphy Center since about a year into its opening. So I guess that makes it about 10 or 11 years. And I work for SummitStone, and so for about more than 60 years, SummitStone Health Partners has been transforming lives through recovery, renewal, and respect by providing unsurpassed behavioral health prevention, intervention, and treatment services in Larimer County. We believe that care starts with yes, and have more than 50 services dedicated to treating mental health and addiction disorders for people of all ages. We know that people can and do recover. And the homeless services team, or it's also known as the PATH program, uses some federal dollars from SAMHSA to allow us to provide substance use treatment and mental health treatment to folks specifically experiencing homelessness, regardless of ability to pay. So my team serves individuals with or without insurance. It doesn't so much matter to us. And we are a skilled group of employees within SummitStone that are embedded in community partner resource centers and various places, such as Murphy Center, 137 Homeless Connection in Loveland, Outreach Fort Collins. Today, obviously, I'm talking about our team that's in Murphy Center. And so we offer walk-in and appointment-based services out of the Murphy Center Monday through Fridays. And really, we do a mix of those things to try to decrease the barriers. David mentioned transportation is a huge one. And also it's difficult sometimes for this population to track appointments and things of that nature. So we provide walk-in and appointment-based services to offer things like behavioral health screenings, individual case management, individual therapy, crisis intervention. And then we also work closely within the rest of the programs of SummitStone to ensure people are able to access other programs via walk-in or referrals, such as our crisis center, group therapy, psychiatric medications, our clubhouse, which is a peer support run model of a clubhouse, and our Garcia House, which is our newest inpatient substance use treatment facility. So at the Murphy Center, there is a team of, I think, five folks. So I have a team lead who's a master's level clinician full-time. I have a substance use counselor who's a CAC 3. She's there part-time and also at Harvest Farm part-time. I have a part-time clinician, master's level clinician. I have a part-time case manager and a part-time peer specialist. And amongst those individuals, we serve about 200 or a little more than 200 unduplicated individuals experiencing homelessness per year out of the Murphy Center. And yeah, I think the benefits of co-location being somewhere at the Murphy Center, and we've had this homeless services team at SummitStone for over 20 years. Nobody's quite sure how long we've been getting this grant, and then we've really expanded the program over the last probably 8 or 10 years. But it's just so much easier to collaborate when you're co-located with other folks. So not only does it make a lot of the it makes our guest and client experience a lot easier, having so many services under the same roof when you have barriers like transportation and wait times and unexpected lines and different things. So, but it also makes our experience of being able to provide services so much easier when you can do these things like warm handoffs and the case consultation that was mentioned. So kind of a weekly get together between numerous service providers to assess the person's current needs, kind of what barriers exist, how to reduce those barriers, a plan for services tasks for each person, each service provider to follow up on with the obvious safeguards of confidentiality in place. And I think that another huge benefit about being co-located is that idea of warm handoffs. And so, the two-way referral, a lot of times, any of us, right, have some apprehension of meeting with a new provider. You maybe are unsure what their approach is going to be, what services. And so really having somebody that can introduce you, do a warm handoff, maybe even sit with you for part of the time as you warm up to somebody else. I think it just ensures that people are able to access the services that they need to access and reduce any fears that they might have. Additionally, with that piece is oftentimes I think somebody, working with a partner agency in the building might present okay in the beginning, and as they're talking about their needs with say someone from Homeward Alliance, they might become upset or get triggered in some way, thinking about these things that they're talking about. And it's just a really quick way over to one of SummitStone's mental health providers to kind of work with that person, process what they're going through, maybe de-escalate them a bit, and then return them. And so they didn't spend all day trying to process this one thing. They kind of interrupted what they were doing, and then were easily able to go back to it after getting another need met. And that is a huge benefit of being in the building. I think there are just so many examples. I was trying to think of specific examples of somebody that's benefited on site, and I just think everybody, all the clients who come into that building benefit from the on-site collaboration and this one-stop shop hub of services model. Whether it's a relatively quick turnaround that we're able to assist somebody, or it's somebody that we work with for 3 years continuously, and then they're stable psychiatrically and they obtain housing and have the supports in place to then maintain their housing. There's just so many examples. One recent example of a client where services will obviously continue, but a person really struggling with some pretty debilitating symptoms of psychosis came in recently, and multiple members of my staff and multiple team members of Homeward Alliance really coordinated on a weekly, if not more like daily basis, to try to really pinpoint when this person came in and designate tasks of who was going to reach out to which partner or which family member, or refer this person to which resource, to really ensure that this person who really wasn't in a place that they could do much of this for themselves at all could really access what they needed to, and be really closely assisted and monitored throughout the process. And I think it's been a little bit over a month now. The person is open to services with SummitStone. They've received their first injection and antipsychotic medication, and so are really reporting a lot less paranoia, really able now to sit down and do the work with those partners that the partners started in the beginning and helped build that rapport. And there's a long way to go in terms of working on housing barriers and getting the person finding a housing opportunity for the individual, but they're much more able to do it now that we've helped them build this resource network and helped with some of their stability. So I guess there's just examples of that all day long, every day, of really how beneficial having services under one roof is to not only the people we serve, but the service providers, and being able to do their jobs quickly and effectively. So I think that is it for me, unless I think we're opening it up to questions at the end, right? So.
Yep, I think we're going to go to Taylor next, if I'm not mistaken.
Yeah, fine.
All right. Yep. All right. Then I'll introduce Taylor. Excuse me. I'll introduce Taylor real quickly. Taylor is our Health Initiative Director at Homeward Alliance. She came on to the Homeward Alliance team right around the start of the pandemic to manage our isolation recovery quarantine site for people who tested positive or had suspected exposure to COVID-19. And she has been really our primary frontline public health expert when it comes to our response to COVID as an agency. She works very closely with staff at the health district and a lot of other agencies to make sure that we're doing everything we can. And now that she's able to start shifting a little bit of her brain to long-term planning, we have a lot of other things that we're hoping to accomplish with the health initiative at the Murphy Center. So I'm going to pass it over to Taylor. Or sorry, I should say health initiative at Homeward Alliance, because it's not just at the Murphy Center, it's really across the whole community. But obviously the Murphy Center as our hub is a place where a lot of things happen. So there you go, Taylor.
Thank you. Hello, everyone. I, like David said, joined Homeward Alliance right at the beginning of the pandemic. It's kind of funny, I actually today, memory on my Facebook popped up of a year ago exactly being at the Aslan Center when we opened that up as our massive congregate shelter right at the beginning of COVID. And if you were to tell me where we are today with vaccine, on that day last year, I wouldn't have believed you. So just know that after a year of being knee deep in COVID response, I am just so grateful and hopeful for where we're going in the future with vaccine and just lowering the cases and death rate of this crazy pandemic. So I think COVID has really been a case study for why health and housing are just inextricably linked. And those who are chronically homeless often live an average of 30 years less than people who have never been homeless. People experiencing homelessness are frequently ill and are disproportionately more likely to suffer from physical health conditions relative to people who are housed. And they suffer in many cases from conditions and illnesses that are preventable or otherwise manageable. With or without pandemic, this community still has a shorter life expectancy, higher morbidity, and greater usage of acute medical services. So a lot of what the health initiative is preventing and managing those conditions and illnesses as best as we can. Our guests experience discrimination and a lack of care from the health system and usually avoid care for those reasons. So we're really working to break down those barriers and establish trust and relationships in a system that's really let down folks for decades in most cases. This is not a new problem. It needs to be addressed outside of the time frame of a pandemic. So that's really our goal here by developing a health initiative at Homeward Alliance, is we're wanting to focus more on prevention, and that way we're less in a crisis mode when it comes to responding to health needs for this population. So really we're hoping to provoke higher level conversations about our healthcare system in this community and health equity and access to care, and even more importantly, with access to care, it's the quality of care. So some of the things that, what it looks like with interacting with folks at the Murphy Center or just across programs, a lot of what the health initiative is helping people with Medicaid and Medicare. That is a very confusing system, both of them. So navigating issues and troubleshooting those kinds of things, what's covered, what's not. Connecting folks to a primary care doctor, transportation to health appointments is usually a big one that we help folks with, or even just to urgent care. Prescription assistance, helping folks, whether it's covering their $2 copay, because sometimes that's the reason, a simple $2 copay is the reason they won't be able to get their meds. A lot of programming and services at the Murphy Center include like dental, vision services, We recently just started a partnership with Dental at Your Door, which is a nonprofit out of the Denver area, and they actually come to the Murphy Center and do 90-minute appointments with folks for really intensive cleanings and exams and x-rays. It's just an amazing mobile service that's serving a lot of our guests. And I think we all know that dental health is just crucial for your whole health. A lot of what we do is, like I said, we want to focus on prevention, but a lot of our guests are in crisis mode, and it's waiting and putting off healthcare until it's an emergency. So we do a lot of coordination with our community paramedics and EMS in the area. And a lot of it's just kind of basic care coordination and case management with folks, making referrals to our Medicaid accountable teams in the area. And then what my primary role has been this last year is really just COVID support with our isolation recovery quarantine site, as David said. We've been isolating folks who are COVID positive or symptomatic, awaiting test results, or quarantining due to an exposure over the last year in several different locations. We've moved and pivoted operations, it feels like 1,000 times over the last year. But I actually was looking at the numbers today. We've served 194 individuals in the last year to date with isolation and quarantine. One of the things I wanted to share with you all is just our plan and partnerships in focusing on getting people vaccinated. I think when we started this endeavor, we were shooting for June or July as being the primary time that we would be getting folks vaccinated. But with the timeline and how much things have quickened, we're actually looking at doing a vaccine clinic at the Murphy Center the week of April 12th, I believe. So also can't believe we're doing this so quickly. The state of Colorado in their distribution plan for COVID vaccine did not prioritize people experiencing homelessness, which was a really hard blow to our organization. And we advocated for months, signing on to different letters to the governor with several different agencies throughout the whole state to advocate for the prioritization. It ultimately didn't end up happening. However, we stand in a really great place where, as of Friday, the whole state is eligible for a vaccine. So that's been a really exciting project for us all. We've been developing this really fun, I'm biased, I think it's fun because I have a public health background and vaccines get me weirdly excited. But we're doing a video education campaign. Everybody at Homeward Alliance and some of our partners at the Health District of Northern Larimer County, we've taken selfies and done videos of us all getting the vaccine just to kind of put it all together in a fun video to normalize it for our guests and make them feel like it's an okay thing to do. And since we're all doing it, they can trust it as well. A lot of that is developing educational materials as well. So different flyers and posters and doing tabling education events where we can sit down and talk with folks and answer their questions and help people understand what the facts are and what the myths are related to vaccine. And, I think what's challenging about vaccinating this group is, like I touched on earlier, there's just a ton of discrimination and distrust within the health system. And so there's always worries about being put into a database. There's always worries about being tracked with vaccine. And so we're having to really be creative on how we talk with folks and really motivate them to get vaccinated, because it truly is the only way we can get out of this as a community. And we really want to shift to being more in person and offering better quality services and getting rid of those masks as well. So this is just a crucial point for this community and mostly what I'm focusing on from a health initiative standpoint. And yeah, I'm just really excited to see where it goes from here. I think that I've said everything I intended to. So I think at this point we're opening it up to Q&A. So I'm not sure who's moderating that part, but I will stop talking now.
I saw there was one question. So in the chat that I can just go ahead and answer. There was a question from Harry: with 20 agencies represented, do they office share? How is there room left over for actually dealing with people who we serve? That's a good question. Office space is definitely at a premium, and it's become, well, COVID has complicated things tremendously in terms of office space. So we've had limited rooms that we're actually able to meet clients in. So we spend a lot of time, we have digital offices, and then the offices where we do meet people are much bigger, or we meet in open spaces. But under non-pandemic times, the main thing that helps us deal with that is that not all 20 agencies are there at one time. So there are quite a few agencies who who provide services that either don't require an office, or they're only there once a week, or a good example of that is Street Dog Coalition. They come and provide veterinary care on a weekly basis, but they don't have an office, so they don't need the same physical space as an agency like SummitStone or Homeward Alliance that's providing mental health treatment in the case of SummitStone, and case management and other services in the case of Homeward Alliance. So that's the primary thing, is just sort of staggering when services are provided, and then having a core group of agencies that provide services. But it's also part of a bigger conversation that's happening in the community related to day and overnight shelter and space for people, just sort of generally speaking, space for people experiencing homelessness to be during the day and overnight. And part of why our Fort Collins city manager formed a homeless advisory committee, which I sit on, and a lot of other agencies and entities sit on that committee, and where that committee is sort of the direction that committee is headed seems to be the development of a new day and overnight shelter for people experiencing homelessness in Fort Collins. Now, obviously, that's not going to happen tomorrow, but if we can sort of decompress the Murphy Center from the standpoint of having to do day shelter there on a regular basis. The Murphy Center was really built as a resource center with offices and some flex spaces. It was never intended to serve 200 plus people a day for day shelter. And so if we have a different day shelter site that's close to, or at least connected to the Murphy Center via accessible transportation, then that will simplify things. In that scenario, we would probably have some staff doing intakes and getting to know people over at the day shelter and making sure they're connecting to the resources at the Murphy Center, and basically just make sure that those two different operations work seamlessly. Another part of it is, another part of it is office space. We do need more office space, and we're in the process of looking for new office space for some of our staff members. So Homeward Alliance went from, I think, something like a dozen employees 2 years ago to 50 employees today. And most of those employees have been working remotely for the last year. Or actually most of them started in the last year and were funded through COVID relief dollars, or just sort of grew out of our COVID response. But while some of those are temporary positions, not all of them are. And so part of what we're working on right now as an agency, and I'm sure other agencies are doing this too, is figuring out where everybody's going to go when we get back to work with our new workforce. I know with some companies, of course, in the for-profit world, it's the exact opposite. There are fewer employees, or they've lost their businesses. In the nonprofit world, it's really been a very different year. It's been a year of trying to figure out how to effectively and efficiently deploy federal, state, local resources to COVID response in a way that not just protects people from COVID, but also sets the stage for long-term positive outcomes like housing successes. Sorry, that was kind of a long answer. There's a question Love the warm handoff term. Is this a new terminology? And if so, when and how did it begin? It's not a new term, and it's not a new term. It's just something that I guess we just have never said it in front of you, Bill and Beth. But it is the difference between a cold handoff and a warm handoff would be before the Murphy Center started. You've got a handoff would be, here's an address, or here's a phone number, call this phone number, or at best, I'll call the phone number with you, or I'll set up the appointment with you. Now it really is, or for the last 12 years, it's been SummitStone's right there. The VOA is right there. The VA is right there. The Street Dogs Coalition is coming in this next week. And so our staff that's responsible for doing intakes and kind of facilitating that collaboration is making sure those warm handoffs are happening. It looks like this next question is for Taylor, so I'm going to re-spotlight her. The question is, do you know of any locations where one can sign up to get the Johnson & Johnson vaccine? The Johnson & Johnson vaccine specifically, a client asked a few weeks ago due to them having, I'm not going to try to say that, but syncope.
Thanks for the question. Unfortunately, what I know right now is that we don't really have the ability to pick which vaccine we get. It's all part of this crazy bureaucratic mess of vaccine distribution. So my best answer to you, if you have a client who specifically needs the Johnson & Johnson vaccine due to health needs, I know that if this person is currently experiencing homelessness, we specifically asked for Johnson & Johnson vaccine for our upcoming vaccine clinic in April, just because of the logistics of trying to get folks back in for a second shot with Pfizer and Moderna. So we did ask for that. It's up in the air if we'll actually get that. So unfortunately, I don't have the best answer for you at this time. I hope in a couple months from now, folks can kind of vaccine shop, as it were, but yeah, sorry.
I know in New York just because I'm from New York, New Jersey, and most of my family's still there. And I know in New York, the CVS is letting you pick at this point which one you get. So if you get vaccinated at CVS in New York City, you have a pick between the three. And I don't know how quickly that'll be the case here, but like Taylor said.
Well, we could send your client to New York, it sounds
Yeah.
like.
We'll get a plane. We'll get a plane ticket, Kerrigan, for that client. I mean, the good news, of course, is that we're opening up on Friday for everybody in the state. So it's exciting. Sorry, I know that was said, but okay. I don't think I missed any questions in the chat. Are there any other questions that folks want to touch on? For Taylor, I should never have unspotlit her. Sorry. How many clients have Medicaid or Medicare versus no healthcare coverage at all? How do you work on all this? And I'm guessing Taylor's not going to have the exact numbers. We do have our data person on the line, and I don't know if Rachel, you've run a recent report on this. If you have, feel free to share. But go ahead, Taylor.
I will just blabber until Rachel runs that report is what we'll do. If I were to completely guess, gosh, Jackie may even be able to answer this better than myself. I think most of our clients are on Medicaid or have been. A lot of the challenges moving from different states, or a lot of the issue with Medicaid is you have to do this redetermination every year and re-verify what your income is. And if you miss the letter or email or phone call that comes to you that says you need to do this, then a lot of our folks lapse in insurance and they don't even know it. We do have a lot of folks on Medicare and Medicaid who are dual eligible because of disability status and income. And so, gosh, I'll ask Jackie. Any guesses on an estimate?
The numbers, I don't know. I'm not really good with numbers.
Well, we can definitely we can. I think that's a report we can run and get that information. But yeah, go ahead, Jackie. I mean, I'm sure you can guesstimate that it's probably most, right?
So So the navigators are the way that people can sign up for that. Just to go back to that point, any one of our guests can come in and just sign up for them, and they can help them sign up for the insurance and food stamps and stuff like that. But yeah, I don't know, my guess would be like 75 to 80% of our guests have some kind of insurance or are in the process of getting insurance. Whether it's adequate to their needs, that's a totally different story, but yeah.
So Rachel is our HMIS, that's Homeless Management Information System, our data. She's a HMIS specialist for the Northern Colorado Continuum of Care, which we previously did a presentation on. So she oversees the data systems for agencies in this federally mandated system, and so she can run that report. But sounds like not during this call. It's a little more complicated than that, I guess, to run that report. But yeah, I would agree with Jackie, just based on my experience, that it's a lot more people than not, certainly, who have insurance, and it's also part of our intake packet. What's your insurance status? And if a person does not have insurance, it's going to be the very first thing we try to help with, pretty much. So I would actually bet it's higher than that, and at least among people who come regularly to the Murphy Center, and if it is more like 75 to 80%, it's because we either don't have information on people who've only come once or twice, or they only came once or twice and never followed up with the insurance piece of it, so we just don't know. So it's very rare for us to, in fact, it would never happen where someone said, I don't have insurance, and we wouldn't say, let's help with that, so I think that's an important point.
Yeah, and Jessica said too, from the SummitStone perspective, she pretty much agreed what we were saying too. Not a lot of folks who are just on Medicare.
Those of us who are, or those of you on the call who have been dedicated navigators in the past, volunteering, and I think I've seen a couple on this call, and I'm sure you'll be back someday soon, hopefully, doing that work. You know that you can actually print a card on the spot for people, their Medicaid cards. So that's been something that we've been doing at the Murphy Center with our dedicated navigator volunteers, now our resource navigator staff. And that's the distinction that we're making, just to keep our brains straight, that our dedicated navigators are our volunteers and our resource navigators are our staff members. It's not that the dedicated navigators are more dedicated. We're just trying to come up with some sort of distinction. And yeah, Jessica's, and then very minimal with private insurance, usually because they're under 20. Okay, yeah, under 26 on a Guardian's plan. That's interesting. Any other questions that folks want to, and you don't have to type it if you want to just jump in, you can. With the recent increase in staff, what are the new positions and what positions will be maintained? I'll add myself to the spotlight here because I can answer this one. So it's a good question, and I don't know. We don't fully know the answer to that question. Just my hunch is that there's a strong likelihood we'll be able to maintain some of these positions with new federal funding because of the American Rescue Plan that just passed, and that was very similar to the bill that passed a year ago, the CARES Act, that funded a lot of what we're doing right now, a lot of the new stuff that we're doing right now. But not all of the funding that we've gotten has been through COVID relief dollars. We've received a couple of new state grants that are pretty significant. We received a couple of county behavioral health services grants that are significant in size. The city has increased its funding substantially. The county has contributed funding actually last year was the first time we received money directly from the county in our history. And then and private donations were up significantly last year. Now, obviously that fluctuates year to year based on economic conditions, but considering the economy last year, I think we were all very pleasantly surprised that individual donations rose by something like 25 to 30% year over year. And our grants and foundations also increased. So it was really an across the board, pretty widespread increase in funding sources. The positions that we're most concerned about maintaining the funding for long term would probably be our resource navigation positions. We have probably funding for about 5 or 6 positions for this year and looking likely for next year. But after that, we're not really sure, because those have been specific COVID relief dollars. Another area where we are, where we're a little bit worried about funding long-term is we just launched a rapid rehousing program. Rapid rehousing is 6 months to 2 year, it's short-term rental assistance and case management services for people who are escaping homelessness, but not the highest barrier folks that we serve on a day-to-day basis. So rapid rehousing is an intervention designed for people who need short-term support and then are able to maintain on their own after that support. And that is, there have been huge, millions of dollars have flown through our state for rapid rehousing programs. And it's all one-time funding. It's 2 years, one-time funding. And so we have a lot of concern about, I don't think we will be able to maintain that program after that because the funding is so massive and it's so specific to COVID. And of course, that's the staff members who took the jobs know that they're in a 1 to 2 year program. The participants, of course, in that program are the ones that I think we're, including the staff, are most worried about, because when that funding ends, that means rental assistance funding ends too. And rapid rehousing is very dependent on rental assistance. So depending on where the individuals in that program are sort of along their journey in housing, when we get to the point where that funding ends, it could be a fairly significant gap. So we're in conversations with a lot of other funders right now already. We've talked about potentially partnering with or trying to get vouchers allocated to this, so that if we have people who need more support than maybe we expected at first with rapid rehousing, that we'll be and won't be able to self-resolve after the 2 years, that maybe we can connect them to a voucher at the end of the process, things like that. So this is a really long way of saying that probably about 20% of our positions are COVID funded out of the 50 right now. 20%, so somewhere around 10 are COVID funding, and those are the ones where we're really going to have to work hard to maintain. So we'll see. It's the American Rescue Plan probably bought us another year of at least of funding for some of these initiatives, but that's obviously not guaranteed either. There's plenty of other entities that need that money. So great question, and remains to be seen. And I think actually one thing I did not say just then that I should mention is that there's the Murphy Center staff that runs the Murphy Center, and none of that is funded with COVID relief dollars. And then there's all of Homeward Alliance's other programs, some of them that operate in the Murphy Center and some of them that operate outside of the Murphy Center. So I just want to make that point, because today we're talking about the Murphy Center, that the Murphy Center is not relying on COVID relief dollars. The Murphy Center has a really strong base of funding. It involves the city of Loveland, city of Fort Collins. Our building owner is a local foundation that is extremely philanthropic. And we just have a lot of support from individual donors and a few larger foundations that are instrumental to the long-term functioning of the Murphy Center. And we have an endowment fund for the Murphy Center should there be a substantial period of economic strife. Looks like Bill and Beth have a question.
Yeah, I just wanted to ask a little bit about our church gave some monies, and I think Pam Brewer was involved in this. So I just wondered if this was related to the rapid response that David was talking about, and that was what we called eviction prevention donations. If you could just kind of explain, is that related to what you were talking about, David, or something?
No, the rapid rehousing is a really specific initiative where we're going to work with about probably 45 people over the course of the next year. And the population we're serving is generally speaking not a population that we're seeing as much on a day-to-day basis at the Murphy Center or other programs. It's really a new venture, new target population. It's a very new thing for us. The funds that we received from Our Saviors, that's what you're referring to.
Yes.
Yes. The funds that we received from Our Saviors Lutheran Church was for our family housing fund. So we have we have a few things that we do with a few programs or a few initiatives that we have for families. We have a collaborative that we formed this last year called Camino a Casa, and that is a partnership between us, Fuerza Latina, La Familia, and Family Housing Network, and that is a resource navigation. We have a staff member who's a bilingual housing navigator. And she works predominantly with people who are Spanish speaking, who maybe are disconnected from services. She works with a lot of people who are undocumented, trying to connect them to different resources, including rental assistance. Sometimes people do not qualify for neighbor to neighbor. Could be because of documentation issues. It could be because they've received money before from neighbor to neighbor, all sorts of different reasons. So we fill in those gaps through the Camino a Casa collective, and then also through direct referrals from agencies. We're sort of a backstop. So clients don't directly apply for rental assistance from us, but the agencies that provide that rental assistance know that we can be that backstop when needed. So beyond the Camino a Casa collective, we provide rent assistance to I can't remember the exact numbers last year, but more than 50 families last year. And the year before, we didn't have that program at all. That was not a COVID relief grant. That was we actually, beyond what we got from our saviors, what started this was we got a $100,000 grant from a private foundation with very little strings attached. And so we worked with neighbor to neighbor and all of these different agencies, figure out what are the gaps, what are you unable to do with your funding because it's strict. Now, when we get a donation like we got from Our Savior's Lutheran Church, those are the greatest donations we can get because they're so flexible. And so in that case, it goes to a combination of things. It goes to rent assistance for people who are at risk of losing their home. That's the primary thing. But then it also could theoretically go to clients to families that are moving into housing. So it could be for first month's rent or for that too. So based on the average check size that we've been cutting, we've been spending about $1,000 per household when we've cut checks, just to give you a sense of the volume. And what we're doing is it is a fraction. It's an important fraction because it's the gap. It's the people who are slipping through the cracks. But I don't even want to try to guess what neighbor to neighbor's numbers are. The last time I heard them, they were just crazy. They are serving so many people, and the dollar figures for what they're distributing in rent is just enormous. They've basically become like a clearinghouse for rent assistance. And then when there are more, when there are complex cases or cases that slip through those cracks, it's agencies like us that step in. I just want to point out that Rachel or Taylor said, Taylor put in the chat that since March 30th, 2020, 60% of new Murphy Center clients reported having health insurance. Of that, 86% indicated they were on Medicaid. The remaining 14% have a mix of Medicare, Medicaid, and veteran benefits. Did I answer your question, Bill and Beth? Just want to make sure. All right. I want to respect everybody's time. We're right at 12.
Pam put the link in the chat if you want to volunteer or find out how to help.
Yes.
Yeah, I would like to point out we just switched over our gear and clothing donations for adults, teenagers, and children to spring and summer stock. So that list is on the link that I provided. Also, we're sort of rejuvenating our Make a House a Home storage unit. As of today, we've helped house 71 people, and most of those people will move into a home with a backpack and maybe a sleeping bag. And so our Make a House a Home program collects small items like utensils and kitchen towels and shampoo and things like that, and basically helps people move into a home with some basic necessities. So the list is also posted on the link if you'd like to help.
All right. Well, just want to thank everybody for coming today and taking the time to listen. Obviously, we will, as Pam said, we'll send out the link. And we just really appreciate your involvement and just looking around at who's there. I look forward to seeing your faces in person sometime soon. So thank you, everybody. And hope everybody has a great day.
Bye.
You all.